Turn now to our GMA cover story. A health alert on fluoride. Health Secretary Robert F. Kennedy Jr. is urging the CDC to stop recommending it in public drinking water. This reignited a decades-old debate. I want to bring in our chief medical correspondent, Dr. Narula. And Dr. Narula, the public health benefits of fluoride are pretty well documented over decades. So why is Robert F. Kennedy Jr. doing this?
Right. So both the EPA and the HHS this week said they're going to investigate the safety of fluoride in the water. Now, 2/3 of the American public drink water that has fluoride in it. Fluoride, a naturally occurring mineral in soil, water, and rocks that basically travels to areas in our body that have calcium, teeth, and bones. Now, the EPA has set a maximum safe limit of about 4 milligrams per liter. The CDC has recommended that we drink water that's much lower in concentration, 0.7 milligrams per liter, and that's what most of us consume. That's found to be the level that's recommended for both safety, but also to prevent tooth decay. Now, essentially, though, it's up to the states and the local governments to decide if they're going to put fluoride in the water and how much. And really, where does this controversy, why is this happening? Well, it's because there's been some research to suggest, now this is not the greatest research in terms of quality, that there may be a possible association with fluoride in high concentrations, much more, almost double the amount we drink, and cognitive issues in children with decreased IQ. And that has led to a push for some of this.
But the original science behind putting fluoride in water showed the benefits.
Correct. So originally this was discovered in the early 1900s. A dentist from the East Coast traveled to Colorado and found that a lot of people out there had stains on their teeth. They called it Colorado brown stains, but they also were protected from tooth decay. And so they discovered that it was the fluoride in the water in Colorado that was protecting them. And by the 1940s and 1960s, this became much more universal. And we have seen a 25% reduction in terms of tooth decay by putting fluoride in the water. We may not think of tooth decay as being an issue, but it is in terms of both pain and suffering, cost, a cosmetic issue, quality of life, eating. So it is really something important, and it is a low-cost opportunity to really eliminate health disparities for individuals who may not be able to get to the dentist or have oral hygiene.
And as you said, most water systems have far below the levels that CDC is warning could be a danger. So what should parents know right now?
Yeah, so first of all, the American Academy of Pediatrics and the American Dental Association are still recommending that we put fluoride in the water. And as with everything else in medicine and science, it is a benefit and a risk. So higher levels than we usually drink can be associated with dental fluorosis, which is that staining of the teeth. Much higher levels, skeletal fluorosis, which can cause brittle bones. And then we talked about the cognitive issues, again, higher levels than that. So you're weighing those risks and benefits, but for the most part, at the levels we're consuming, this does seem to be safe. We've obviously seen a reduction in tooth decay, as I said, by 25%.
Dr. Narula, thanks very much.